Each week within the Public Health Essentials curriculum, we get to really dive down into what it means to tackle public health. This could mean analyzing our community data. It could be how do we look at the different services within that community, and then working through different strategies that could affect behavior change. At the end, we get to be able to go back and describe the effects that it has on different individuals and really prepare to present a public health topic.
Public health is the science of protecting and improving the health of people and their communities. In the U.S., there's an expectation that no matter where we live, work, learn, or play, we all have an equal opportunity to be healthy. Kansas State University Extension agents Tristen and Clara Wicoff know, however, that is not always the case. They're part of 25 extension professionals in the north-central part of the country taking a long look at health in America's communities and what they can do to encourage equal access for all. On today's Sound Living, initiating public health efforts. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. K-State Research and Extension Family and Youth Development Agent for the Chisholm Trail District, Tristen and Extension Nutrition Food and Health Agent for the Southwind District, Clara Wicoff, were selected to participate in an 18-week course titled Public Health Essentials, designed to build capacity of non-traditional public health organizations such as Cooperative Extension to engage in multi-sector initiatives to improve community health. Tristen, as part of this, maybe a little bit of background on what you do at the community level right now for Extension.
Right now, within the Chisholm Trail Extension District, one of my biggest projects is tackling the child care crisis. Within Marion County, we're meeting about 31% of the need for child care, and within Dickinson County, it's a little over 50% of the need for child care. So within both counties across the district, tackling child care and ways to solve the issues of child care, which could include bringing more child care providers to the table, establishing new centers, supporting the workforce, are all different issues that I am working on currently.
We know that child care is an issue. There's never enough of it. It's expensive to begin with. But how are you tackling this then at the local level?
Yeah, within the local level, I established a task force here in Marion County as well as in Dickinson County. And we have started analyzing different community level inputs. So we have done community assessments, we have done business surveys, inquiring the workforce and their need for childcare. It eventually kind of came down to we had community members calling in and saying, I can't find anywhere to send my child to take care of them so I can go to work. So it has actually became a workforce issue. We've been able to see more of our local government start to become more involved when it has impacted the workforce and the availability of bringing in new individuals to live within our county.
Is this part of the effort of Extension then to reach out and form these partnerships within the community?
Yes, it is so much within Extension's realm. It's really within the realm of community vitality as well as your family and youth development. So it's a perfect fit for what I am doing within my job and one of the reasons why I'm so passionate about it.
What's the response been so far, I guess? I know that you're probably in the initial phases of this, but are you getting more and more people on board?
Yes, we are getting a lot more individuals on board. Looking at in Marion County, one of our initiatives, we are actually looking at starting a child care center that would hold up to 99 children. So this is very initial phases, but we are getting so much community support from this. We are having individuals call in and ask questions. We are having some media attention where our local newspapers or our mayors or different city individuals are reaching out to us saying, how can we help you to solve this crisis or to solve this initiative that you're working on?
Clara, I know you haven't been on board with Extension as long as Tristen has, but what are some of the things that you're focusing on in the Southwind District?
Certainly. So still trying to figure out a little bit of my specific role in the communities within the Southwind District, but definitely part of that so far has been related to my passion for food security. So figuring out how Extension can have a seat at the table in promoting local food access. So whether that's partnering with local farmers markets, the Double Up Bucks program, even working with some community coalitions that are doing work to promote local food access among all demographics, all age ranges. So that's some of the work that I'm really passionate about and excited to be starting some work on. But as a nutrition, food, and health agent, really covering a broad range of health things. So lately that's been working a lot on Walk Kansas and helping get people connected to that wonderful program. But then even doing things like this week, working on some herbs programs, getting ready for some kids cooking classes. So really a wide range of programming that at the end of the day is all tied into health.
In regard to the food access and the food security issue, was this something that you identified or was this something that the community identified?
I would say both. So it's one of the reasons that I, after finishing my master's degree, came back to Southeast Kansas. It was something that I developed a passion for in high school while working with the summer food service programs here in Southeast Kansas and seeing the need for food during the summertime for school-aged youth. So that was something that both I saw, but also the community has done assessments and surveys, and it's really clear that there's a need here in Southeast Kansas for some work on improving food security, both for children and for adults. And so that was, something that was really a draw for me to come back to my community to focus on and work on.
Is this something that has been kind of a brainstorming session? How are you tackling this, I guess is what I'm interested in, is how do you get all the players together and then come up with solutions?
Yeah, so it's still, some of it is brainstorming. There's been work that's been being done on this for a while now. And so just continuing to figure out, especially with everything that we've seen happen during COVID and how that's exacerbated some pre-existing challenges, how we can move forward. And so a lot of it is still in brainstorming and bringing people together and having conversations, but also making sure that we really bring impacted individuals into the conversation and center the conversation on impacted individuals. But a lot of it is still in some of that brainstorming, but there is work being done to collaborate with some grants and different programs to take some action steps as well.
You have both been involved with the Public Health Essentials curriculum, and I'm wondering, first of all, what are some of the things you learned during this extensive course, but then also how are you able to maybe bring this into some of the issues that face your communities?
So Clara and I were actually honored to be selected and nominated to begin the inaugural cohort for the Public Health Essentials curriculum through Cornell University. So this is a brand new program. We are part of 25 representing the North Central region. And so it is brand new, and we are very excited to keep going within this curriculum. We actually began in March. It's 80 hours is what they're anticipating, and it will last through August.
So tell me some of the things that you have tackled already as part of this curriculum.
Yeah, when learning about the curriculum, we're really understanding what is public health. Within that, we get to look at the different lenses and different areas that make up public health. This could include the social determinants of health. It could be looking at the different sectors, so your education sector. You could be looking at the employment sectors. It could be looking at all kinds of different areas within that. And then we look at how does this relate to the work that we are currently doing? How does it relate to you as an individual? And then larger out, we're looking at your community base, when looking at your organization, when looking at the different policies that make up your local government or even within your state or at a federal level. So really focusing on what can you do to better support the resources that you have or the programs that are made available to the individuals living in your community, and then bringing it back up to how is the system as a whole helping to support that individual.
Clara, what are some of the things that you have discovered so far? I guess you're really just a few months into this, but what are some of the things that you've discovered?
Yeah, I think coming from, so I have an academic background in systems thinking, so some of this really tied into some of that work of looking at wicked problems as a whole and trying to look at it through a systems thinking lens. So I've really appreciated that. I appreciate how the program is set up so that with each unit, you're really applying the material to your specific location. So it's not just hypothetical, it's really thinking about how can I take those social determinants of health and how can I see those in my community? How can I think about those when I'm doing programming, when I'm thinking about, for example, something in extension we face when we have people not come to a program. So thinking about, well, why aren't people coming to a program? Are there other factors at play here? How can we help address those factors with, like Tristen talked about earlier, something like the child care crisis. If people don't have child care, that can make it impossible for them to come to a program. If people don't have their basic needs met, it's really difficult for them to benefit from what we're offering in extension. So I think that's been something that's been really good for me to hear about and think about as a relatively new agent, thinking about how I can address some of those basic needs and how the work I do can be viewed through a public health lens.
Some of this also deals with finding some of those gaps that currently exist within the health system within maybe your local communities. So is that another area that you think you'll have an opportunity to maybe find out a little bit more information that will help you close some of those gaps?
Yeah, so one area that I'm really focusing on, just as I mentioned before, is how to work within that childcare sector and how to really address the issue that we have of not enough childcare spots made available within, honestly, across all 105 counties within Kansas. Also, how to establish that workforce and be able to provide some stability to our child care providers. And then in addition, how to focus on and how to combat the issue within legal childcare. That's a really hot topic right now within the early childhood realm and within the realm of KDHE as well. And so when looking at the state of Kansas, what are some areas that we can focus on to find this? And just as Clara talked about, when you start breaking down the different social determinants of health, one area that really stands out is going to be your economic stability, but also your education. And so if those two areas are not being met, that's going to set up a greater challenge for later life development. Knowing that early childhood is such an essential age when 90% of your learning is happening during that time frame, knowing that is happening and then that not everybody has access to that early learning, that becomes a social determinant of health. That becomes a public health issue. And so for me, finding different ways that we can analyze this and look at the current childcare crisis, but also having and learning new terms that I can use when I'm working with others across the system. So for me, understanding how different individuals within the civic sector or with businesses alike, being able to use some of their same terminology to come from a public health standpoint, when my background is in early childhood education. So having those different lenses and those terms to work through, as well as kind of their background as well, has really helped me.
Is this something that even as you're going through the curriculum now that you can start to share with other agents and specialists so that you can kind of share as you go?
Yeah, I would say yes. And I would say also not even just limited to within K-State Research and Extension. I think there's an opportunity to connect with other partners in the community. You know, Tristen talked about working with others within the system. So I think there's a great benefit, even in the conversations that I'm already having with different coalitions and community organizations, to bring some of this to the table now and think about the social determinants of health and the work that we're doing before even completing this program. So I think that there's a lot of opportunity to take this material and help spread it to others.
As you really move further into the process here, what are you hoping to learn maybe over the next few months? And then as the course continues, will you focus in a specific area? Will you be tackling just a specific project? How does this work through the entire course?
So each week within the Public Health Essentials curriculum, we get to really dive down into what it means to tackle public health. This could mean analyzing our community data. It could be how do we look at the different services within that community, and then working through different strategies that could affect behavior change. At the end, we get to be able to go back and describe the effects that it has on different individuals and really prepare to present a public health topic. So this could be tackling each different area that we've talked about today. So whether it be the child care within our community, whether it be healthy initiatives and healthy starts for our families and our communities within our district. But really, each different way that we are understanding the public health is going to be able to open up, at least my brain, to be able to take on more different viewpoints or lenses, to be able to understand what it means if there's an issue or a barrier within our community. And then we hope that we can get to go back and share this again with not only our extension family, but also those within our community. So being able to really sit down at that brainstorming table and say, here's the barrier, here's the issue that we're facing, this is where we would like to go, but let's back up a step. What are some things that are contributing to them not being able to overcome that barrier? What are different viewpoints or different areas that we need to look at? Are there more supports? Are there resources that are needed? So being able to analyze that whole picture when we're working within our local communities, all the way through different state issues and state tackles that we have within our own extension family, as I mentioned.
And I would add, I'm eager to continue to learn more about identifying those strategies that influence behavior change and thinking about how do we make that healthy choice the easy choice, and how do we tackle those other barriers that exist that can make the healthy choice a harder choice. So I think that's something that I'm really eager to continue to learn about and then take it back and apply it within my own community and, of course, share it with community partners within K-State Research and Extension and, outside of that. So I think that this is a really exciting opportunity and one that I'm really honored to have been selected for.
That's K-State Research and Extension Nutrition, Food, and Health Agent for the Southwind District, Clara Wicoff, and Extension Family and Youth Development Agent for the Chisholm Trail District, Tristen Cope. More information about community health, including efforts and programs in your area, is available from local extension offices in Kansas. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.